be presenting. And she's been a lead in this also. I'll let you go to the next slide there, Stacy. So our HRSA grant, USD was awarded this grant back in fall of 2022. And we were awarded $1 million for 3 years. So it is coming to an end here at the fall of this year. We had 2 parts to this grant. One of them was to get more nurses out into the rural health areas. And then the other part to that was to recruit more Native American students into the nursing program. And so we had 2 people working on the recruiting side. And with that side, they've been visiting schools, hospitals. They've been holding different fairs and different events, attending different events across the state of South Dakota, recruiting students from high school into nursing programs that way. And along with that recruiting side of it, they've also been visiting the different tribal nations. We have 9 tribal nations in the state, and they've been visiting those tribal nations twice a year. As far as trying to get more nurses out into the rural area, with that, we've been placing students into clinical immersions into the rural hospital setting across the state. And that's been going really well. So they do 135 clinical hours out in that facility, following the nurse, immersing themselves into that community, and really learning what it's like to be in that setting. The students take a survey before and after their experience, and all of the students have expressed that they have an increased knowledge of rural health and an interest in rural health nursing up to this point. Go to the next slide.
Well, thank you, Katie. I want to share with everyone that this project, as you know, Katie Franson is a nursing instructor at USD Nursing. I am the USD site director here in Vermilion. But Katie and I both live in rural settings, different rural settings. And this rural health project is really near and dear to our hearts because we live in rural communities. I worked as a rural health nurse in a rural access clinic for 10 years. It's just a big part of who we are, and we're just so appreciative that we can share these experiences with our future nurses and our nursing students so they understand how impactful care is in the rural setting and for the community members. And also in return, as a nurse, you just grow so much from rural health. It's a really unique opportunity. So as Stacy shared, because we're presenting to a global community, people will have access to this presentation from all over the world. It's important for people to know where South Dakota is. So that's what we'll start out talking about. And this is just a map of the United States and looking at where the US is. And Stacy, you could move on to the next slide. So, and there is South Dakota, which is in the central part of the United States. As we all know, we're in the Midwest, is our region that we are in. We're in the center of the state, or excuse me, center of the nation. For weather-wise, we have all seasons for all weather. And as we know, this week, we've had winter and we've had spring and we'll have summer. So our climate varies. So with that affects our rural population. Next slide, Stacy. So this is our state of South Dakota, and the X's are the places that our students have gone for rural access hospitals. The western side of the state of South Dakota is more of the Black Hills is located in the western side of the state, along with Mount Rushmore. It's a tourist area. It is a beautiful mountainous area with, right now they have skiing going on out there. I mean, there's just all kinds of opportunities on the western side of the state for recreation. As you can see, there's rural hospitals there on that side that we have helped in. And then on the eastern side of the state, it is more of a flatland, more of a farming region. And in between, from Rapid City over to Sioux Falls, to get across the state, it takes about 6 to 7 hours. So that tells you kind of how big it is. But in the center, in between those two sides of the state, it is more of a prairie land, more flat land, less farming ground and more pasture type of land. And you can see that there aren't very many hospitals in that area that we have been to yet because of the increased rural setting. And so as we finish out this grant, we hope to get more X's there in the middle of the state and up in the northwestern corner of the state as well, is what our goal is as we're moving forward with this grant. So that's a little bit about South Dakota. Next slide, Stacy. So these are our objectives for our ECHO session today. The first thing that we're going to be doing is we're going to be discussing nursing experiences in rural South Dakota. So we'll have 3 students, USD nursing students, who will be presenting today about their rural health experiences through the HRSA grant that they were participated in. We're also going to understand stigma and discrimination and their impact on mental health, and also recognize available resources and initiatives to improve the mental health in the rural setting. And so the next slide. So now we're going to start our introductions with our first case study. Jacelyn Medicine Crow is a 4th semester nursing student for USD Nursing, and she is located on the Sioux Falls campus, Sioux Falls, South Dakota. And if you can remember, that was kind of on the eastern side of the state, in the middle of the state. And it actually is the largest city in the state of South Dakota, in Rapid City. But Jacelyn actually is from Chamberlain, South Dakota, and is an enrolled member of the Crow Creek Sioux tribe, which is located north of Chamberlain, which is Chamberlain's in the middle of the state in that rural area. For the HRSA experience, I followed a nurse at the Chamberlain Hospital, and she was excited for this learning opportunity in a rural facility. Jacelyn's time at the hospital, she said, was amazing, and she learned so much from the staff. And she also said that she gained confidence and practiced skills and learned more about how rural facilities operate and care for their patients. Jacelyn also said that the HRSA experience was a great opportunity for her to gain more confidence and to see how different that the rural facility is from the typical clinical area. So Jacelyn, I'm going to hand it over to you.
Thank you, Helene. So if you want to go to the next slide, please. Perfect. So just a little bit about Chamberlain and its location and the facility. So Chamberlain is a small town that sits along the Missouri River in central South Dakota. This rural community is home to nearly 2,600 residents. Sanford Chamberlain Medical Center has 5 ER beds, with 1 trauma bed included, 16 med-surg beds, 3 postpartum rooms, and 2 delivery rooms. The facility offers inpatient and outpatient services, and there's also a nursing home attached that was built recently and moved from downtown to connected to the hospital. So since this is a rural facility, it serves residents from many other communities in the area, like the 2 reservations to the north, those towns being Fort Thompson and Lord Rule. Also close by across the river is Owacoma, so a lot of people from that community work and utilize the Chamberlain Hospital. Puckwana, which is actually where I grew up, is about 7 miles east. And then Kimball and Reliance. So background, I would say the residents of Chamberlain are primarily white and Native American. Most residents are employed in healthcare and like educational services. So there is just the one hospital. They do have one Avera clinic located more downtown. And then for schools, they have the Chamberlain Elementary, Middle, and High School, as well as the St. Joseph's Indian School. So that employs a lot of the residents. Chamberlain is home to the South Dakota Hall of Fame, the Dignity of Earth and Sky statue, which you can see on the slide there, and also the Octo Lakota Museum. The town itself is a popular tourism location because of its location along the river. Definitely brings in lots of fishermen and hunters and such. But it's also just a great place to immerse in the Native American culture, being that they do have that museum and other landmarks to go visit and learn from. So for assessment, during my time there, we really cared for a diverse, amount of patients. Some that I can recall, definitely like diabetic issues. We did wound care, took care of patients with wound vacs. I saw paracentesis due to liver failure, chronic heart failure, cardiac issues. We had a couple STEMIs. We were able to treat them as much as we could in the facility, but most patients who need more higher up care, we do fly them out to Sioux Falls. With the nursing home being attached as well, we would care for residents from there if they needed anything. So like Rocephin shots, things of that nature. Mental health was definitely something I saw as an issue there among the residents. For example, we had one patient who actually spoke with a provider via telehealth through the iPad, and it was determined that that patient should be transported to Sioux Falls for further care. This is where the rural facility kind of met some barriers with transportation. So, but my nurse handled it really well with trying to find transportation for this patient. She contacted, which they often do, like the local PD to see if they had anyone available to make the 2-hour drive to Sioux Falls. But at that time, at that night, they weren't able to have an officer help. They also just try to contact patient family or friends to see if there's anyone that could transport them. But eventually what did happen with this patient is this nurse was able to come in contact with a facility out of like northern Minnesota, which is to the east of South Dakota. And it's about, from where this person came to transport was about 5 hours away. So the patient had to wait for them to get there and then be transported another 2 hours to Sioux Falls. So this just kind of made me realize how much of a barrier that can be. I do know that the Chamberlain Hospital does have, I think like Monday through Friday during 8 to 5 hours, they do have an employee who transports patients. I know he does drive to even like Fort Thompson or Lower Brule, which are over 20 miles away, and he'll bring patients for dialysis appointments and things like that. So I just think that they could really benefit from something in the evening hours or on the weekends. But that's something that, rural facilities will probably always have an issue with. But I really liked that my nurse went above and beyond to find the transportation that they needed for that patient. So yeah, thank you.
Thank you, Jacelyn, for that presentation. It's interesting when we're talking specifically today about stigma and discrimination and the impact that it has on mental health. And so in talking about that stigma and that discrimination that occurs because of mental health issues, and you kind of presented that when you are talking about the travel issues, and looking at how can we overcome those barriers. And you just said it perfectly there, that we have to promote and encourage those inclusive policies, and then also those supportive environments that supports the transportation, that supports the needs of the population. So that was a great example of that, what that nurse did. That's exactly what's needed. Just much more to improve on that. So thank you for sharing that.
Hey, Jason, I have a quick question for you. In that community, since you're a couple hours from Sioux Falls, do you know what mental health resources they do have there for the people who are struggling and the homeless?
Yeah, so I do know they have, I can't think of the exact name, but they do have a facility. I know the location, it's by the grocery store where they do have like therapists and such. And I know at the hospital there is a therapist employed too. So during this scenario, it started right before 5. And so she was still in the building. So she came up to the ER and kind of helped facilitate the iPad and getting in touch with the provider in Sioux Falls. Um, but I'm not sure that there is like a specific person in the hospital for those situations. They kind of, I know like if you go online and look up providers in Chamberlain to be seen for mental health issues, a lot of it is via telehealth with a provider in Sioux Falls. So I just think that's something that they don't have as an option in that facility.
Okay, yeah, that helps. Thank you.
Are there any other questions? All right, well, thank you, Jason.
Thank you.
Next, I'm going to introduce you to Haley Skiles. Haley is also a 4th-semester student. She will be graduating in May, and she'll be graduating from the USD nursing program in Sioux Falls as well. So Haley grew up and attended high school in Sioux Falls, South Dakota. And since she graduated from high school, she's been working in healthcare. Throughout high school, she worked as an assistant at an assisted living home. And then while she's been in the nursing program, she's worked as a patient care tech at the Central Resource Pool. And last summer, she did an internship with the Central Resource Pool as a cluster C nurse, which is the ICU rotation. She was offered a job after this internship and will be working in the Central Resource Pool as a cluster C ICU nurse after she graduates and passes her NCLEX this May and June. So Haley, I'm going to turn it over to you. Thank you.
Thank you, Helene. I was in Sturgis, and Sturgis had 18 med-surg beds, 3 outpatient beds, and with those beds, it was lots of infusions we did. 1 hospice suite, 3 ICU beds, but if it was a severe case, we would fly them to Rapid or Sioux Falls. 6 ED beds, and then 1 trauma room. Then the background, Sturgis is about 7,000 people, and they have an elementary, middle, and high school. So lots of rural people around the community come in for job opportunities and school each day. Then Sturgis Hospital is a critical access hospital and provides 24-hour emergency services, inpatient and outpatient care, end-of-life care, and is co-located with a nursing home attached to it and also has a clinic attached to it. The assessment, we saw lots of patients, anywhere from mental health cases, disorders and challenges, chest pain, antibiotic therapy. With that nursing home attached, there was lots of elderly people that would come in with falls and stuff like that. End of life care, influenza, COPD. Then if it was more of a severe case, we would transfer and airlift them to Rapid or Sioux Falls. Sturgis continues to grow with their technology and resources, but a recommendation I would have is more mental health resources. I feel like our mental health room was always full with a patient, so I feel like if there was more counselors in the community or any resources, that number would be able to go down.
So Haley, tell us what this mental health room, what was that? What kind of clients would go in there? Was it off the ER or what was that set up? How?
The mental health room that was in the ER, and it was kind of attached to the nurses station, so there was a blind we would pull up. Then in that room we would have no equipment. So we would have a cart that we would pull in for vital signs or any things we would have to do with the patient. Then with that, there would also be a CO, which is a constant observer, would sit with the patient and do, we had a sheet, so they would do, every 15 minutes, they would write down what that patient is doing. Um,
And you said that that room was used frequently?
yes, every time I was in the ER, there was at least one or two patients coming in per shift. Um, then we would transfer them to Rapid City or even Sioux Falls sometimes for mental health services. I feel like there was some suicide attempts we would see. There was a bridge near the hospital, and there was a couple times people jumped off that. Um, so just a variety of mental health challenges. Thank you.
Are there any other questions for Haley? Well, thank you, Haley, for sharing. And I think Haley has some slides. If on to the next slide, she has some pictures of the facility in Sturgis. Do you want to explain these at all, Haley?
So with the Sturgis Hospital, there was the ED, then the med surg area. And as the HRSA student, they were very good about if I was on med surg for a day and a trauma came in or anything cool, they would pull you right away to the emergency room so you could watch and interject as you could. So you can kind of see like with that lower right-hand picture, the emergency room. Then over to the left of that, that's our med surg wing. Then to the right, that's the clinic attached.
Looks like a very nice facility.
Yes.
Well, thank you, Haley. So now we're going to move on to the next slide, and I would like to introduce you to Nuwich Tornyang. And Nuwich is a 4-semester student also at the University of South Dakota in Sioux Falls. She is proud to say that she grew up in Sioux Falls and she graduated from the Washington High School in Sioux Falls. She's come from a very tight-knit family. So when she's not busy studying, she's spending time with her family. She also goes to church, travels, serves in their community. And at once in a while, she says she likes to take an extremely long nap, which we know probably doesn't happen very much during nursing school. But and she is excited to share her HRSA experience with us today. So Nuwich, I'm going to hand it off to you. Thank you.
Okay, hello everybody. Um, so I spent my time in Del Rapids, which is only 30 miles north of Sioux Falls. It is considered part of Minnehaha County. I decided I wanted to go with Del Rapids just because I could just commute back and forth. So I would just drive there and drive home, which I thought that was a nice option just because I'm a homebody. So it's hard for me to want to leave for too long, but a hotel is an option. But it is part of Minnehaha County, like I said, and there's like about 4,000 people in the community. It's growing at a really rapid rate. Like if I was going around the town and noticed like they're building houses like everywhere that you turn. So I thought that was cool that it was growing so fast. And it was like a Vera hospital, but it's a critical care access hospital. It had 23 beds and they offered a lot of services. So I was surprised at how many services they had, but they had like an emergency room, inpatient and outpatient. They did a lot of colonoscopies. I think I saw like 9 of them. And they had like OT, PT, radiology, and then there was a swing bed. So like a little bit more about Del Rapids. It's like a rural town and it's located right on the Big Sioux River. It was very family friendly. I saw a lot of like families at the park and at the baseball fields and stuff like that walking around and exercising. For schools, there's a lot of children in the town, which I thought was really nice too. So there's a private school is the St. Mary's Catholic Church got their own school. So like it had like an elementary school, so preschool to eighth grade, I mean. And then the other building was a high school, which was ninth to 12th grade. And then there was a public school, a middle school, and then two public elementary schools. So it was definitely a growing community. Um, During my time in Del Rapids, at the hospital, like every day was like something different. So one day I went there and we had no patients. Then the next day I went and there was like 10 patients and that had came over from the nursing home that's across the street. So it's like, and every day is just a surprise in those rural communities. Um, they had the pediatric care. We did a lot of chronic disease management and rehabilitation, and there was like an infusion center, so we did a lot of like blood transfusions, antibiotic therapy, stuff like that. Um, I would say the down part about Del Rapids is that it's considered Minnehaha County, like I said earlier, so they don't get a lot of the rural funding or recognition that they are rural South Dakota, which a lot of like the surrounding communities, people from like Coleman and Madison were driving up. And then I also thought it was interesting, a lot of the people who lived in Del Rapids said that they usually just go to Sioux Falls for treatment. But that hospital is pretty old, like the structure's old, and I know that they said that they were building a new hospital in the next few years, so I thought that was cool too, and excited to see how that turns out. But I would say just because it's like rural South Dakota, we did use telehealth and stuff, but I think they needed to like just upgrade their equipment a little bit and use more technology. Overall, I had a really good time over there. Like as a student, I would say it's a really good experience because it was like one of my first times like being one-on-one with the nurse. I was the only student there, which was nice too, because sometimes you just feel like you're in the way at the main hospital. So I had a lot of learning opportunities. My nurse was really wonderful too, and I did my first IV over there, and she was so dedicated to me learning how to do an IV that she let me practice on her first before I did an actual patient, which I thought it was cool because I've only ever done a mannequin. So, yeah, I would just say like 10 out of 10. I highly recommend. It was just like a wonderful learning opportunity. I was really bummed when I had to leave, and I do think that that's something that you guys should do if you can. Thank you.
I have a question for you. First of all, very, very awesome that you were at Del Rapids. I actually went there as a student myself when I was in nursing school, and it is a fantastic facility. What kind of mental health challenges did you run into there? Did you see very many patients that came in with mental health needs?
I didn't see too many patients with mental health needs. Like most of them would end up going to through the ambulance to Avera Behavioral Health because it's only that 30-minute commute. I did have one patient who was doing like he had to do antibiotic therapy and he had like a chronic UTI, so he's already came in and got treatment. He was admitted and they discharged him. He went home and he still had a UTI, so he would have to drive like every day to the hospital to get like a 4-hour infusion of antibiotics. And he just was like really bummed, and you could just tell like kind of depressed from the situation of just like kind of like that back and forth and having to sit there for so many hours, which I thought it was cool that they did let him go back and forth instead of admitting him because he had said that he has like two dogs that he didn't want to leave. So I thought that was really mindful of them to still let him do the commute back and forth, but it's probably taxing on your body and your mental health for sure.
Great, thank you.
Yep, thanks.
Yeah, I don't really necessarily have a question, but I have a comment that I think, well, I guess I could turn it into a question. Because he was already depressed, because of his chronic issues and needing to go back and forth, what do you think that would have done to his mental health had they expected him to stay in the hospital versus being able to go home and be with his dog?
Well,
It's kind of spectacle, spectating, but how do you think that was better for his mental health to be able to go home and
I personally see I don't have a dog, but I see what it does for other people who have dogs and just like the love that they feel for them and sometimes
Mhm,
I even support animals and being able to sleep in your own bed versus like in a hospital bed. So I think he probably would have been worse if he stayed in the hospital because he like I said he was already at the hospital for like 2 weeks and to come again for another 2 weeks in the hospital food. I think it was probably better for his mental health, but I guess
mhm. Yeah, I'm glad to hear that they were able to let him do that and that he found a way to make it work.
Mhm.
There's no place like home to heal, especially for our elderly when they have pets at home. That's important.
Yes.
Are there any other questions for Newich? All right. Well, thank you, Newich, for sharing your experiences with us.
Thank you.
So next, we're going to move on to our subject matter expert for this presentation today. And on to the next slide is a picture of Lori Dumke. And Lori is the Chief Operations Officer for Horizon Health, which is a federally qualified health center with 22 locations across the state of South Dakota. So throughout those places where we even were at, there are many of those towns do have Horizon Health there, but then there's many other more rural places that we haven't even been that they do have some operations in those communities as well. So Horizon provides medical, dental, and behavioral health services at 31 clinics statewide. Lori holds her undergraduate and graduate in nursing degrees from the Nebraska Methodist College, with her Master of Science in Nursing, specializing in the Chief Nurse Executive role. Lori is originally from Omaha, Nebraska, and she now lives in Valley Springs, South Dakota, with her husband Jordan and their young son. She enjoys family road trips, exploring rural South Dakota, golfing, mowing the lawn, shopping, and reading. And we welcome Lori to be with us today and thank her for sharing her expertise in this area. So, Lori, I'm going to hand it off to you now.
Awesome. Thank you. Do you mind not sharing the screen while we chat since I don't have slides? I like to see people's faces. I like to shake things up, guys. So my name is Lori Dumke. Like Helene said, I'm the COO at Horizon Health. I want to tell you a little bit more about federally qualified health centers, and what rural and frontier actually means. And we're gonna switch a little bit from a lot of you guys have hospital experience or you were placed in a critical access hospital, but what federally qualified health centers are comprehensive primary care clinics. So I'm going to take a step back here for a second. So yes, Horizon is in 22 different communities across the state of South Dakota. It is comprehensive primary care. So we do medical, behavior health, and dental all under our Horizon umbrella. We don't have all three of those services at each one of our locations. They're kind of strategically placed throughout the state. So and based on staffing shortages, which I'm sure you guys have talked plenty about as well, for those services. We provide behavior health mainly through telehealth, but also in person. And we are we're calling them mainly frontier communities. And so while yes, we can call Del Rapids or Sturgis a rural community, we are in towns of 130 people. 400 or less is most of the towns that we are in. We serve on 8 of the 9 reservations as well. And the challenges of accessing healthcare in general are huge for all of those communities that we serve. So that's actually why health centers are created. So FQHCs, federally qualified health centers, right? They're all interchangeable words, but HRSA, so who funded this lovely experience for you guys as well, actually many moons ago, the government realized that there are many places in the United States that have an increased barriers in accessing healthcare. And so they developed the health center program. And so we are partially federally funded to be in those most rural and frontier and underserved communities. Horizon is just in South Dakota, but there are health centers across the nation. Now, most of you guys probably have a clinic from where you guys are from, and you don't know that it's a federally qualified health center. It's usually just your community clinic. You've got one nurse, one provider, one front desk, and that's the entire clinic, right? So that's kind of the frontier communities that we serve. And when that happens, the closest ER is 3 hours away in most of our communities, if that, right? And if we call that the closest ER, if it's not a critical access hospital, it can be up to 7 hours for some of our people that they would have to get care otherwise if we were not there. So that's who we are. I'm here to talk about stigma in the impact that it makes on mental health. And the first thing that I'm going to say about that is I don't call it mental health. It is healthcare. And when I'm talking about mental health conditions, I call it behavioral health. Not just me, that is the community in general. We are shifting from calling things mental health because of the stigma that mental health brings. There's when you are in nursing school, you learn about the worst case scenarios. Okay. That's just what it is. You think mental health means I'm in a crisis situation where somebody has just attempted or, wants to attempt suicide. You are in a bipolar break. You're schizophrenic, right? And those are a point in a person's time, a point in time in a person's life. Primary care is really bridging the gap for our general population, right? I mean, of anyone who has your depression, anxiety, bipolar, schizophrenia, etc., on a day-to-day basis. And we're able to take care of those things in rural and frontier settings through primary care providers. And so most of our primary care providers can take care of your common mental health issues, if that's what we're labeling them as. See, the label is the hard part about the stigma. But then we also have psych nurse practitioners in-house that can help some of those elevated issues. So our primary care providers can take care of somebody until they're at a certain severity, and then it's out of their scope. And so we can call in our psych nurse practitioners or our behavior health team, which are our licensed clinical social workers. One thing that I really want to talk about and why behavior health is so important in primary care settings, especially in rural and frontier communities, is that it is still, the stigma is still so high that they don't want to be seen going to the mental health provider or the counselor or whatnot. They don't have an issue going into their primary care provider, where they could be connected to a behavior health provider or a psych NP through telehealth or right there in the primary care clinic. So when you're at the grocery store and you see somebody driving by, or, they're like, oh, I was driving by the clinic earlier and saw your car there. Everything okay? People don't have to say, oh yeah, I'm just seeing a counselor or there for behavior health reasons. I think that is one of the biggest reasons why behavior health is so important in primary care settings. Another thing about, I'm trying to think. I wrote some notes here and trying to think. I could talk on lots of different topics, I think, but the stigma around mental health and getting treatment really does prevent people in our rural and frontier communities from doing so. You think about your farmers, your lawyer, your grandpa, your daycare provider, etc. The stigma around going to see a behavioral health provider is still so prevalent in our communities. That they don't want to. And so we're able to access and break down some of that stigma by putting it into primary care or doing some behavior health right from your home, right? We're able to connect through telehealth to licensed social workers, et cetera, and people get to stay home and do counseling services straight from their living room or where they're most comfortable. Another thing that we have implemented in primary care settings and FQHCs to help reduce some of the stigma around behavioral health is substance use disorder services. And so I hope at this point you all know that substance use disorder is very prevalent in South Dakota, whether that's alcohol, meth, opioids, right, which is huge, all can be taken care of by a primary care provider, which helps reduce that stigma as well. There aren't that many rehab facilities in South Dakota. They're very scarce resources. And so through medication-assisted treatment and the combination of therapy, people are able to get substance use disorder treatment right from their hometown, their clinic, without people ever even knowing that that's what they're going for. We also reduce stigma by going into schools in our rural communities. So we partner with schools all the time, but our primary care providers go in and talk about things like depression, tobacco use, peer pressure, bullying, things like that, and just try to openly talk about it, starting from a young age. Another thing that we do is everyone, no matter the reason that you're coming in for a primary care visit, you could be coming in for a sore throat, or you could be coming in because you have depression. We are universally screening all of our patients that walk through the door for depression and anxiety. And so we're hoping that gives people an avenue that even if they're not coming in for depression or anxiety, you ask them a couple questions and it just takes one time for them to say, you know what? I do want to talk about that. And then that's our foot in the door to be able to talk about how you don't have to live this way. Let us help you. I don't know. I think those are kind of the things that we try to do in primary care, and it's just really integrate it into the healthcare of a person. It's your whole person. Again, I think that if we could shift in general to talk about behavior health and behavior changes and instead of mental health, that will really help as well, because it also helps describe what our licensed clinical social workers can do, or Psych NP providers, our behavior health providers in general do, is they really focus on behavior change, right? So they can take care of somebody who is schizophrenic and has your highest diagnosis of behavior health disorders, or they can talk to somebody about a behavior change for quitting smoking, for your uncontrolled diabetes. You think about it, if your A1C is 14, you need to modify your behaviors. And so that's how you can tag team with primary care. So it's not just about taking care of severe behavior health disorders. I don't know, guys. What kind of questions you got for me?
I'll start, Lori, just for starters, just by saying thank you. Oh my gosh, that was so interesting, and I learned a ton. I love listening to you. And just I know for sure that I need to change my language, because I honestly have just always, I think we talked a couple times about, like, should we be called behavioral health? We weren't quite sure, but everything you say makes perfect sense. So I will definitely do better with that. I have a question for you. With these real frontier areas, do they even have like access to AA or Al-Anon, or is there any kind of support group things, or what probably not. Is that like online or what do they do for that or not really?
Yeah, some churches have some of those support groups, but no, mainly, I mean, that's the real answer is not really. And so unless they're doing something online, but most people in our frontier communities are not doing online things. That's just not happening. So your support is through your provider.
I have other questions, but I don't want to take them up. So anybody else first?
I'll ask a question. Again, I want to thank you for bringing up the fact that words do matter. You know, when we're talking about behavior health and mental health, because it does make a difference with stigma. And you were mentioning that in rural communities, I don't know if depression and anxiety are quite as prevalent in smaller frontier communities as they used to be. But I also, yeah, okay. And then I'm not, haven't looked at those statistics for a while, but in my experience working behavior health, I know that people who have a lot of anxiety or depression, it's really hard for them to leave their home.
Mhm.
They don't want to, and that's why follow up with their providers is difficult because they can't leave the house. And a lot of times they'll come up with excuses why they can't come to their appointment, right? And I saw that a lot in my work, that they just wouldn't follow up. And then they end up 2 weeks later back with us again. So I'm wondering, is telehealth helping with that? Do they still like use the same excuses to not attend a telehealth appointment because of their depression and not being able to, even though they don't have to leave their home? Is it making it, are there statistics out there to show that that's making a difference?
Yeah, great question. First, I want to just quickly address something that might be interesting. You talked about you're not sure about mental health, depression, and anxiety in our frontier communities. Dawn and I were actually at a rural health summit together not that long ago, and somebody presented on the fact that our farmers in South Dakota are 2.1, I think was 2.1 times more likely to be suicidal than others, which was mind blowing to me, honestly. And then we kind of talked about why farming is an isolating job and lifestyle. And so then I understood. So I just wanted to kind of point that out as you were curious for that as well. Yes, telehealth has helped by tenfolds for compliance for behavioral health services. We also have case managers that work on our no-shows and our high-risk patients, right? And so if you don't show up, we're calling you, right? What are you doing? You don't want to come in today? Cool. You want to jump on a call right now? I'm open, and so having those different avenues, you don't have to come to the clinic. You don't have to go anywhere. You can be in your house and you can be in your car. I don't care. You want to stop where you're driving? Let's chat. And so we are able to do that via telehealth. Now, during COVID, we could do it via phone call as well, but we no longer get reimbursed for that. Not that everything is about reimbursement, but that is not a common practice anymore of just calling and having a conversation on the phone. It's more video telehealth. But yeah, it's helped a ton. Anybody else?
Any other questions for our expert here that's with us, and truly an expert who have really shared some great information? Are there any other questions?
Well, thank you guys so much, and make sure you go to ruralhealth.org in frontier communities. They're awesome. They are so friendly. You get to do a wide variety of nursing experiences. You'll put in more than one IV, I promise. Yeah,
So
you get to see a
with that,
variety.
Lori, where can they look for job openings that are,
Oh,
should they go to look for that?
yeah. Our website is horizonhealthcare.org. Super easy.
Great.
Google Horizon.
Mhm.
All of our opportunities are out there. But if you're looking for internships as well, we work with students all the time throughout the state. Housing is always a thing for us because in a town of 150 people, there's not a hotel or Airbnb around. But that's okay. Sometimes they stay with our providers. They stay with at one of our clinics. We built in our clinic in Martin, South Dakota, we built a like studio apartment essentially in the basement of our clinic to house students and traveling providers and stuff too. So we'd love to have you guys.
I think you could have a more wonderful boss too, if you ended up with, yeah, Lori would be a great leader to have. There was one other thing I was thinking. Oh, I know what it was, Lori. Have you heard if any of the federal cuts are going to impact your funding for all your programs? Hopefully not, but just curious.
So with the continuing resolution that just passed, health centers have stable funding, which is not good or bad news. We were asking for an increase. We have not had an increase in funding in over 10 years. And so that is a huge impact. We will also see what happens with the Medicaid, on a federal level because that will impact our state Medicaid, which would impact our funding and reimbursement greatly.
We'll do some praying and finger crossing on that one.
Thank you. Policy changes matter. Policy drives healthcare. Thanks, guys.
Thank you so much, Lori. I so appreciate you've been here. So I guess we're going to, you're welcome to use the chat box for any questions that you may have of any of our presenters today, or you can just unmute your microphone and ask in person as well. Are there any questions or comments that you have about today's session?
And then before anybody goes, Stacy does have a link for a survey that we would like you all to take before you go. So please do that before you leave.
Did you see the question?
Yes. So does Horizon offer through the HRSA grant? Our HRSA grant placements that we'll have yet this summer, that'll be our last round, is we are affiliated with hospitals only, rural access hospitals. So our HRSA grant isn't with them, but as Lori shared, it does sound like they have maybe some summer internship programs through them that you can look at on their website. I'm just going to review our objectives today to make sure that we have met what we said that we were going to do. We said that we were going to discuss nursing experiences in rural South Dakota, which our nursing students did a great job of sharing their experiences. We said that we were going to understand stigma and discrimination and their impact on we didn't say this, but we're saying it now, on mental behavior and behavioral health. And then we're going to recognize available resources and initiatives to improve behavioral health in the rural setting. And thank you, Stacy, for giving us the right language to use. Thank you. We appreciate that.
And thanks for including your email there, Lori, for the students.
Well, thank you, everybody. You have a wonderful afternoon. Thank you, Lori and Stacy, for helping to set this up for us.
Take care.